more dangerous than sugar. The one common medicine that destroys your heart health if you think you know what the biggest enemies of your heart are. I need to tell you something. You're wrong. There's something way more dangerous, sneakier, and even worse, more present in your everyday life than you imagine. Something that might be inside your own house right now, disguised as a solution, but actually slowly destroying your cardiovascular health. And no, we're not talking about fat, sugar, or salt. This goes way beyond your diet. We're talking about something you might be taking with the best intentions, thinking you're taking care of your health. But in reality, you're quietly feeding the risk of heart attacks, arrhythmias, heart failure, and even sudden death. Imagine living with something that, every time you use it, wears down your vessels, overloads your heart, and speeds up the appearance of problems that you'll only notice when it's already too late. And worse, you might have never suspected that this could be the real culprit. How many times have you felt tired, with palpitations, chest pain, shortness of breath, and thought it was just stress, anxiety, or fatigue? What if I told you that, actually, this might be just the beginning of signs of something much bigger happening inside you? Something directly linked to this invisible enemy. In this video, I'm going to reveal a truth that few have the courage to tell. You'll understand which seemingly harmless habits are wrecking your cardiovascular system, and most importantly, you'll discover which medicine is the most destructive, harmful, and silent for your heart health. Pay attention, because from now on, you'll never see these choices the same way again. Number 11. Obesity medications. The desire to lose weight fast leads many people to take dangerous medicines like Femproporex, Mazendol, and Anfepramone. Although these meds promise to suppress appetite and speed up metabolism, the price you pay can be way too high, especially for your heart. These compounds work by strongly stimulating the central nervous system, which causes a series of serious side effects. Among them are accelerated heartbeats, significant blood pressure increase, and heart overload. What seemed like a quick fix actually turns into a silent risk. These medicines act similarly to amphetamines, stimulating the release of neurotransmitters like dopamine and noradrenaline. The problem is this mechanism puts the body in a constant alert state, like it's in danger. This leads to a major increase in heart activity, which, if prolonged, wears down the heart structures. It's like the organ is forced to work double time, day after day, without rest. Imagine the impact on someone who already has a predisposition to hypertension or heart problems. Studies have already shown a clear link between using these substances and increased risk of heart attack, arrhythmias, and even strokes, CVA. And we're not just talking about long-term use. In some cases, just a few weeks are enough to trigger devastating effects on the cardiovascular system. The heart literally becomes overloaded, beating faster and stronger, which can cause irreversible damage. What seemed like a simple weight loss pill could actually be the start of a big health problem. The risk is even greater when these medicines are combined with other common factors like a sedentary lifestyle, poor diet, or excessive coffee and energy drink consumption. All that amplifies the negative effects on the heart, creating a dangerous and often invisible scenario. Unfortunately, many people ignore the first warning signs, like palpitations, dizziness, chest pain, and extreme fatigue. These symptoms clearly show the body isn't handling these stimulants well. Besides the physical impacts, there's also a psychological effect that often goes unnoticed. Using these substances can cause anxiety, insomnia, and even depression, which in turn further harms the cardiovascular system. The cycle is vicious. The more anxious and worn out a person feels, the more their heart suffers. And when the body can't take it anymore, the most severe complications arise, which can be fatal if not treated in time. And stay alert, because if you think these meds are dangerous, know that there's another type of medicine, way more common, that's even more destructive for your heart. It'll be revealed in the last chapter of this video, so don't miss it for anything. Number 10. ADHD medications. ADHD meds like methylphenidate, Ritalin, and lisdexamfetamine Vyvanse have become super popular in recent decades. They're effective in controlling attention deficit and hyperactivity symptoms, improving focus and performance. However, few people know these meds have a deep impact on the cardiovascular system. That's because they're basically powerful stimulants that speed up various body functions, including heart function. These stimulants increase dopamine and noradrenaline levels in the brain. This puts the nervous system in a constant alert state, like extreme stress. And if the brain is on alert, so is the heart. The result? Faster heartbeats, higher blood pressure, and in severe cases, arrhythmias. It's like driving a car at 200 kilometers per hour for hours, putting huge pressure on the engine until something breaks down. Risks are even higher when meds are used without proper medical supervision, which unfortunately happens often. Some people take these stimulants not just for ADHD treatment, but to boost academic or work performance, without thinking about the effects on the body. This practice greatly raises the risk of heart failure, heart attack, and even sudden death in extreme cases. Also, these meds can cause persistent high blood pressure. And unlike many think, you don't need a history of hypertension to develop this problem. Continuous use, even in controlled doses, is enough to overload the cardiovascular system. Add stress, lack of sleep, or bad diet, and you have a recipe for disaster for your heart. Another worrying point is that these meds can cause psychological dependence. The body gets used to the hyperactive state, making it hard to live without them. And each time they're used, the heart pays the price, working beyond its natural limits. Over time, this not only wears it down but also harms its structure and function. Number 9. Migraine medications. Triptans like sumatriptan, zolmitriptan, and rizatriptan are widely used by migraine sufferers. They provide quick and effective relief by constricting the blood vessels in the brain. But this same mechanism, which brings relief, hides a serious risk for heart health. These meds aren't selective only for brain vessels. They also cause vasoconstriction in the heart's arteries, which can lead to serious cardiovascular problems. When these arteries constrict, the blood flow meant to feed the heart muscle is reduced. This can cause angina, chest pain, and in severe cases, heart attacks. This risk is even higher in people already predisposed to heart disease, high blood pressure, high cholesterol, or smokers. Imagine what can happen when, while trying to ease a headache, you unknowingly put huge stress on your heart. The problem is users aren't always aware of these risks. The meds are often used repeatedly, especially by those with chronic migraines. Every triptan dose adds pressure to the heart arteries. Over time, the body accumulates the stress until one day it can't take it anymore. It's a silent risk that might go unnoticed for years before showing tragic results. Another important point is that the vasoconstrictor effect doesn't only impact brain and heart arteries, but can also affect other body parts. This includes higher blood pressure, chest tightness, and even difficulty breathing. Symptoms often mistaken for anxiety or stress, but are actually clear signs the heart is suffering. For those who need these meds, specialists recommend occasional use under strict medical guidance, never overusing. Also, periodic cardiovascular exams are essential to catch any early signs of overload before things get worse. Managing headaches shouldn't cost your heart's health. Number 8. Fluoroquinolone antibiotics. Antibiotics like ciprofloxacin, levofloxacin, and norfloxacin are widely used for urinary, respiratory, and intestinal infections. They're powerful and effective meds, but hide a risk few know about. They can be extremely dangerous for your heart. Studies show these meds are linked to a significant increase in arrhythmia risk, aneurysms, and even vessel ruptures. So something that starts as a simple infection can turn into a much bigger problem. Their action mechanism blocks essential bacterial enzymes, but unfortunately also affects our body's tissues like tendons, cartilage, and mainly blood vessels. Weakening vessel walls can cause aneurysms and in extreme cases rupture. Imagine that happening in major arteries like the aorta, which carries blood from the heart to the rest of the body. Besides vessel risks, these drugs also interfere with the heart's electrical conduction, increasing the QT interval, a measure that, when altered, greatly raises the chance of fatal arrhythmias. These electrical changes can happen even in people with no prior heart problems. This means a simple treatment with these antibiotics can cause emergencies like dangerous tachycardias and, in extreme cases, sudden death. The problem worsens when these meds are used unnecessarily, which is unfortunately common. Overusing antibiotics for viral infections, where they don't even work, just ups the risk with no benefits. Each new exposure adds risk, especially for older people, those with hypertension or family history of heart problems. And it's not just the heart. Fluoroquinolones are also linked to tendon damage, causing spontaneous ruptures, especially Achilles tendon ruptures. This, combined with cardiovascular risks, makes these antibiotics a true ticking time bomb if not used responsibly and with strict medical follow-up. The advice is clear: only use when absolutely necessary. And beware, if this sounds alarming, wait for the last chapter where you'll find out which medicine is the most destructive to your heart health. And surprisingly, it's way more common than you think. Number 7. Diabetes medications. Medicines like glibenclamide, gliclazide, and glypyride are widely used to control type 2 diabetes. They work by stimulating the pancreas to release more insulin, helping lower blood sugar. But few know these meds also pose a serious heart health risk. Studies show long-term use is linked to increased heart failure, circulation problems, and even sudden death risk. These meds have a side effect often ignored. By forcing the pancreas to constantly release insulin, they can cause severe hypoglycemia episodes. This sugar imbalance affects not just the brain, but also the cardiovascular system. When blood sugar drops sharply, the body goes into alert mode, releasing adrenaline. This raises heart rate, blood pressure, and sometimes causes fatal arrhythmias. Also, these drugs are linked to higher congestive heart failure risk. This is due to the effects of hypoglycemia and high insulin levels on arteries, leading to vessel stiffening, plaque buildup, and inflammation. All this creates a perfect environment for atherosclerosis, hypertension, and heart attacks. The problem worsens in patients with a history of heart problems, hypertension, or high cholesterol. In these cases, cardiovascular risk doubles or even triples, depending on usage time and dosage. It's like carrying a silent ticking bomb ready to explode anytime without warning. Another worrying factor is many patients don't get proper guidance about these risks. They think they're only treating diabetes, unaware they might be seriously compromising their circulatory system. This causes small signs like palpitations, extreme tiredness, and chest pain to be overlooked, even though they're important warnings. Number 6. Proton pump inhibitors, the hidden villain in heartburn. Meds like omeprazole, pantoprazole, esomeprazole, and lansoprazole are often prescribed for heartburn, reflux, or gastritis. They work by reducing stomach acid production, providing quick, effective relief. But there's a dark side to continuous use. They can seriously harm your heart health. This happens because by suppressing stomach acid, they also impair absorption of essential nutrients like magnesium and vitamin B12. Magnesium deficiency directly impacts heart function. This mineral is essential for electrical conduction in the heart muscle. Low levels significantly raise the risk of arrhythmias, palpitations, and even cardiac arrest. And this problem doesn't appear overnight. It builds up silently over months and years of ongoing use. Also, vitamin B12 deficiency caused by less stomach acid has serious consequences. B12 is essential for blood vessels and nervous system health. Its lack raises a compound called homocysteine, which in high levels damages arteries and promotes atherosclerosis. Result: higher risk of heart attacks and strokes. Studies show people using proton pump inhibitors for over a year have higher chances of heart failure and ischemic diseases. This means heartburn relief could be costing more than you think. Worse, many use these meds continuously, without supervision, thinking they're totally safe. Risk is even higher for people with hypertension, diabetes, or high cholesterol. The lack of magnesium and B12 adds up to existing problems, speeding up cardiovascular wear and tear. What seemed like stomach protection becomes a direct heart threat. So, it's crucial to rethink use of these meds. They're important for short-term treatment, but prolonged use must always be monitored by a doctor. Looking for natural alternatives to treat heartburn and reflux might be a safer long-term choice. Number 5. Hormonal contraceptive pills. Hormonal contraceptive pills are widely used worldwide. They offer convenience, cycle control, and pregnancy prevention, plus help with conditions like polycystic ovaries and acne. But few know these small pills can pose a huge heart health risk. Continuous use of combined pills containing estrogen and progesterone, or even estrogen-only pills, is linked to a significant increase in thrombosis, stroke, and heart attack risk. This is because hormones affect blood clotting. Pills increase substances that favor clot formation, raising artery blockage risk. This is especially dangerous for women who smoke, have high blood pressure, high cholesterol, or are over 35. This combo turns something seemingly harmless into a real ticking bomb for the cardiovascular system. Also, estrogen in pills contributes to artery hardening, known as atherosclerosis. This increases the risk of plaque buildup inside blood vessels, leading to heart attacks and strokes. Even more worrying, many women use these meds for years without proper medical follow-up. Warning signs often appear subtly: leg pain, chest tightness, palpitations, and shortness of breath. These symptoms are often mistaken for anxiety or stress, but actually clearly indicate circulatory overload. Unfortunately, these signs are often ignored until emergencies like thromboembolism or serious cardiac events occur. It's vital to carefully evaluate contraceptive pill use, especially for women with cardiovascular risk factors. Safer alternatives, like non-hormonal methods, should be discussed with a doctor. The decision shouldn't be just about convenience, but mainly about heart health. And if you think risks end here, know they're just beginning. In the last chapter of this video, I'll reveal the most destructive medicine for your heart. And believe me, it's so common you'll be deeply surprised. Number 4. Corticosteroids. Corticosteroids like prednisone, prednisolone, and dexamethasone are powerful meds used to treat inflammation, allergies, autoimmune diseases, and even respiratory crises. They're lifesavers in emergencies, but when used continuously or in high doses, become deadly enemies of the heart. That's because they cause a series of metabolic changes that directly impact cardiovascular health. Long-term corticosteroid use raises blood pressure, LDL, bad cholesterol, and triglyceride levels. They also promote fat buildup inside artery walls, called atherosclerosis. Over time, this narrows vessels, making blood flow harder and raising heart attack and stroke risks. The heart works harder under pressure, literally. Another devastating effect is increased insulin resistance, favoring type 2 diabetes development. The combo of diabetes, high blood pressure, and high cholesterol is the deadliest trio for the cardiovascular system. It's like the whole body enters metabolic collapse, affecting every heartbeat and blood vessel cell. Risk is even greater for those genetically predisposed to heart disease or with hypertension, heart failure, or family heart attack history. In these cases, corticosteroids speed up vascular damage, often causing irreversible complications. What starts as temporary pain or inflammation relief may actually cost years of healthy life. Early cardiovascular overload signs are often mistaken for simple side effects like tiredness, fluid retention, and weight gain. But these are clear warnings that something serious is happening inside. Ignoring them is taking unnecessary fatal risks. So corticosteroid use must always be cautious, for the shortest time possible, and closely monitored by a doctor. Considering alternatives and complementing with dietary changes and natural anti-inflammatory practices is essential to protect the heart. Number 3. Second-generation antipsychotics. Drugs like olanzapine, quetiapine, risperidone, and clozapine are crucial for treating mental disorders like schizophrenia, bipolar disorder, and resistant depression. They help thousands maintain emotional stability and functionality. But there's a hidden cost. These meds are extremely harmful to heart health, being among the drug classes that impact the heart the most. Continuous use is linked to big increases in total cholesterol, LDL, bad cholesterol, and triglycerides. They also significantly raise blood sugar levels, contributing to metabolic syndrome, a group of conditions including abdominal obesity, hypertension, and insulin resistance. As we know, this combo is a major cause of heart attacks and heart failure. These meds also cause rapid, often uncontrollable weight gain, especially around the belly. This fat is especially dangerous because it releases inflammatory substances that damage blood vessels and overload the heart. Cardiovascular risk grows with each kilo gained, and damage accumulates silently without patients noticing. Another critical point is these drugs directly affect the autonomic nervous system, which regulates heart rate and blood pressure. This means they can cause tachycardia, arrhythmias, and persistent high blood pressure even in people without prior heart issues. The impact is deep, constant, and often irreversible. For those with risk factors like sedentary lifestyle, family history, or hypertension, use of these antipsychotics must be strictly monitored. Frequent checks of cholesterol, blood sugar, blood pressure, and heart function are necessary. Ignoring these measures opens the door to sudden, devastating complications. Number 2. Tricyclic antidepressants. Tricyclic antidepressants like amitriptyline, nortriptyline, and imipramine were widely used in the past and still prescribed for certain depression, chronic pain, and anxiety cases. Though effective, they carry serious heart risks. Few know they interfere directly with heart's electrical conduction, causing potentially fatal arrhythmias. The big problem with tricyclics is they block sodium channels in the heart. This affects how electrical impulses travel, causing irregular beats known as arrhythmias. They also chronically raise heart rate, causing tachycardia and putting constant load on the heart muscle. Imagine living daily with your heart beating faster than it should, non-stop, no rest. These meds also raise blood pressure in some patients and impair venous return, which can cause fluid retention and heart overload. For those predisposed to hypertension, heart failure history, or high cholesterol, effects are even more dangerous. Risk of heart attack, failure, or sudden death rises with prolonged use and lack of monitoring. Another alarming point is tricyclics can enhance effects of other meds like nasal decongestants and some antihistamines, further raising blood pressure and heart rate. This drug interaction often goes unnoticed, putting patients at higher risk without them realizing. Anyone taking these meds must have rigorous follow-up, including periodic heart exams and ECGs to monitor heart's electrical function. Also, modern alternatives like selective serotonin reuptake inhibitors, SSRIs, are usually safer cardiovascular-wise. And if you think all this is alarming, get ready, because in the last chapter, I'll tell you the most destructive medicine for your heart health. Without exaggeration, it's so common you probably know someone who uses it. Number 1. Nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs like diclofenac, ibuprofen, naproxen, and ketoprofen are probably some of the most consumed meds worldwide. They're in practically every home, used to relieve pain, fever, and inflammation. But behind this apparent benefit, there's a huge, silent, underestimated danger. They're extremely toxic to the cardiovascular system. The big problem with NSAIDs is they interfere with prostaglandins production, substances involved not only in inflammation, but essential for protecting blood vessels, kidneys, and blood pressure balance. By blocking them, NSAIDs cause sodium and fluid retention, leading to high blood pressure and heart overload. It's like the body is forced to work with way more blood volume than normal, demanding extra effort from the heart. Also, these meds cause blood vessel constriction and promote clot formation. This means heart attack and stroke risk rises significantly, especially in people with risk factors like hypertension, high cholesterol, diabetes, or family history of cardiovascular disease. And you don't need to take large amounts. Even occasional use can trigger serious complications in some people. Recent studies show diclofenac, for example, is directly linked to a big increase in heart attack risk. And this isn't just for continuous users. People taking the drug for a few days, but at high doses, are also at risk. The impact is so big that in some countries this medicine has been withdrawn or sales heavily restricted. Another worrying factor is that symptoms of heart overload caused by NSAIDs are often mistaken for the pain that led to their use. Chest pain, palpitations, or shortness of breath may be seen as muscle or joint pain reflections, when actually it's a sign the heart is struggling. This delays diagnosis and worsens consequences. Given all this, it's clear NSAIDs are some of the biggest villains disguised as allies. So their use must be cautious, medically supervised, and safer alternatives considered, especially for people with any cardiovascular risk. And to keep getting the best videos for your health and well-being, subscribe to the channel. It exists for a simple reason: to help you become a stronger and happier person. And in the video appearing now on your screen, I reveal 11 early symptoms of pancreatic cancer you must not ignore. They can cost you your life. To watch that video, just click on the screen. See you in the next video.